First, I want to thank everyone who's doing the right thing and staying home. Virginia is a leader in fighting this pandemic. Thankfully, this weekend, we did not see the crowds at our beaches and our state parks like we saw a week ago, and for that I say thank you. Science tells us that social distancing is the best way to fight COVID-19. That's why it is important to stay home. I know that it is difficult, but we will get through this together. I'll remind you that social distancing is for everyone. We're still seeing that nearly half of all cases are among people under the age of 50. It's also important to remember that people can transmit this virus even if they don't have symptoms. That's one reason why the CDC, the Center for Disease Control, has now issued guidelines for people to wear cloth face coverings when they go out, such as to the grocery store. Face coverings can help reduce the spread of COVID-19. If a person is wearing a face covering, it is less likely that droplets from a sneeze or from talking will spread out into the air. And if you're wearing a face covering, it can offer some level of protection against those droplets. It also makes you more aware of accidentally touching your face. You don't need a medical grade mask to do this. In fact, you can make your own. The internet has many patterns and instructions for how to do so, even if you can't sew. You can even use rubber bands and a bandana. I would advise everyone to wear a face covering when you're out. No one should assume that if they wear a face covering, they are safe and can go about their business as normal. Unless you're wearing a medical level mask, you will not have medical level protection. That's why social distancing continues to be so important. I thought I might bring you my face mask. This particular mask was designed and made by our Department of Corrections. It is comfortable. When applying it, you just want to put it over your face, covering both your nose and your mouth. It has a rubber band to go behind your head. And I would also remind you to, at night, or depending on what your shift is during the day, but to once a day at least to wash it with soap and water, or to put it in the washing machine and then dryer. I also want to reassure Virginians that if you are wearing this face covering for the purpose of protecting yourself medically, nobody in Virginia will give you any problems. Nobody will write any citations. Now let's move on to some news from our state lab. Our Division of Consolidated Laboratory Services is starting to use genetic technology to help our public health officials better understand COVID-19. DCLS is doing this work alongside the CDC and international public health and university partners. They are building a library of genetic information from the positive test DCLS gets, as well as those from private labs, health systems, and university systems in Virginia. One insight they have already learned, it appears that the virus was introduced in Virginia in multiple communities, rather than spreading from one single source. I'm proud that DCLS is one of the first public health labs in the nation to do this very sophisticated work. This will help our public health officials understand the virus, how it spreads, and how it may change. And that will help give us more tools to fight it. On Friday, I announced that we have chosen 3 sites for alternative care facilities: the Dulles Expo Center, the Hampton Roads Convention Center, and the Richmond Convention Center. We are finalizing those contracts, and work to build out those facilities will begin this week. I have spoken frequently about the severe shortage of personal protective equipment for our frontline medical professionals. This shortage is both in Virginia and nationwide. We have been working with every angle to buy more PPE. I'm thrilled that we have executed a $27 million contract with Northfield, a Virginia-based logistics company, to provide PPE. We expect the first shipment of PPE from Asia to arrive a week from today. We have also signed a contract with SD's Trucking to handle logistics and distribution. We have begun shipping 56,000 MREs, that stands for Meals Ready to Eat, to food banks, and this can supply our food banks for the next 6 weeks. We have also received and shipped out hand sanitizer. Our health department has shipped 1 million old H1N1 masks and supplies to be reconditioned and distributed by the Virginia Hospital and Healthcare Association. VDH has also shipped the third round of supplies to hospitals from the Strategic National Stockpile. Now let's move on to a note just a bit on testing. Virginia, like other states, has not been able to get the volume of testing materials that we need to do widespread testing. Sentara Healthcare has announced that it is starting to do in-house testing, which should allow for faster processing times for tests at hospitals in the Sentara network. This is a positive step. We continue to work as fast as we can on testing that will have a 15 to 30-minute turnaround, and I thank all that have been part of this goal. I issued our stay-at-home order a week ago. I believe Virginians are taking this seriously, and I, on behalf of the Commonwealth, thank all of you. Now we need to keep up the good work. Social distancing and frequent hand washing are our most powerful weapon in this battle, but we must continue to use it for it to work. In the weeks to come, we cannot relax our vigilance against this virus. The more everyone stays home, the safer we all will be. Finally, I want to note that this is National Public Health Week. The COVID-19 outbreak has shown us how vital the work of our Department of Health, our local health districts, and all of our public health workers is. From VDH Commissioner Dr. Norm Oliver through our state epidemiology department and to the local health workers tracking each case of COVID in their communities, our public health people have been working nonstop. On behalf of Virginia, I want to thank them all. Their work is appreciated now and all year round. Our entire health community is working to make sure Virginians get the services they need, whether it's our public health system, our frontline medical staff, or the community-based providers who are trying to figure out how to continue supporting our aging or disabled populations. We're grateful to all of them. Now I'll ask Dr. Oliver to give us a health update, and then we'll be glad to take your questions. Dr. Oliver, thank you.
Thank you, Governor. The Virginia Department of Health website was updated this morning at 9 a.m. with the following figures. Our total number of cases now has reached 2,878. That is 241 new cases in the last 24-hour reporting period. The total deaths now stands at 54, and that's 3 new deaths in the last 24-hour period. Thank you.